Hi, I'm Melissa Cady, and I'm independent anesthesiologist, and my business name is Painless Wellness. And I've been working with Dr. Piazza for over 8 or 9 years, and have been asked since 2020 to cover his cases at the Stonegate Surgery Center. And I'm happy to be providing your anesthesia care for your breast augmentation. Now, as far as what to expect for the day of surgery, I'm going to take you through a little play-by-play. And if at any point any of this you have questions about, you can bring that up during our anesthesia pre-op or anesthesia consult, and I'll be happy to answer those questions. But typically the surgery center, which is separate and apart from me, although I've been working there for many years, they will call you the day before typically, or if it's a Monday case, usually the Friday before, occasionally 2 days before if it's during the week, but they will let you know what time to show up. That can change from time to time. So when they tell you to arrive, you can go back 8 hours and make sure that you haven't eaten anything. That's the most important rule for an elective case. I will cancel you if you have eaten the morning of surgery for your own safety, but for 8 hours at least, you can go 10, 12 hours, it's fine of not eating. Now you can drink water during that time frame. Except for the last 2 hours, I like you to refrain from actually drinking full cups of water, just a few sips if you need to take a pain or a pill of some sort. It could be an anti-nausea pill. Those particular pills like a Mend or a Prepotent, it's the same thing, can work up to 24 hours. However, that's usually for people that are really concerned about nausea, have had a strong history of it. I typically give 3 or 4 different anti-nausea medicines. Most anesthesia providers will give 2. And that'll cover 95% of people. However, I like with the 4 that I've given, usually 99% of people are covered very well based on how I've been doing things as of late. So if you want to take that pill, the Amend or Prepotent, you can take it with a couple sips of water. Now, as far as when you arrive to the center, there'll be different policies. Make sure you follow those policies. You'll be led into the waiting room. Family and friends, as of right now, can be led into the waiting room unless something changes. But at some point, they'll take you from the waiting room to the pre-op area, and make sure you bring your phone. If you're there by yourself, you can stay connected with those you love, especially if you're a little bit nervous. It's pretty typical to be a little bit nervous, but sometimes distraction can be helpful, and slow, deep breaths can also help the nervous system. But once you're in the pre-op bay area, one of the nurses will go ahead and check your blood pressure and everything. They'll go ahead and check the consent form. They'll go ahead and have you change out of your clothes and put your belongings in that bag that they give you. They'll go ahead and start a small IV. That little IV is probably the size we can put in children as well. So it's not a big IV, but something reliable. Typically, they'll go to the hand or the forearm. That's the most ideal location for multiple reasons. If they need to go to the elbow area, I can work with that as well. And then, of course, as far as your hair, if you have long hair, I highly suggest putting it like something in this elastic, something without metal. You can go ahead and put it in a ponytail bun, not at the front like a unicorn, or not at the back, but just on top in a ponytail bun would be great. If you have short hair, you can just leave it be. We do have a little disposable bonnet that we put around your hair. I'll come say hi at some point. The different nurse called a circulating nurse who comes from the operating room will come say hi. And of course, Dr. Piazza will show up and do any pictures or markings behind the curtain in that bay area. And then once we're ready to go, I'll give you a little IV margarita, so to speak. It's a little sedative or relaxing medicine, or I'll give it to my nurse to give to you, just depending on the timing. And most of the time you don't remember getting to the operating room, even though you're awake, just sedated. Sometimes it's like a weird dream, it just depends. If you're used to taking medications like that, then sometimes you can remember a little bit more than someone who's not used to taking medications like that. Once we're in the room, we'll go ahead and get you onto the other bed. Again, you may not remember any of that as well. I'll go ahead and get all the monitors on, let you breathe some oxygen. And once I'm happy with the setup, then through the IV that you got, the IV margarita, I'll go ahead and give you additional medication to get you fully asleep. And that's essentially general anesthesia, meaning you're unconscious. Once you're unconscious and asleep and don't know what's going on, I do not plan on putting a regular breathing tube in most breast augmentations or breast cases, unless they're extremely long cases, certain types of medical conditions. Instead, what I use is just a little soft plastic device. It just slips behind your tongue and you don't know about it. It's when you're deep asleep and need the most help. But when you're laying on your back, I don't want your tongue to get in your way when you're breathing on your own. So that little device also, it contains the medication that's mixed with the oxygen. So I'm not breathing it, and Dr. Piazza is not breathing it either. So that just remains in place. I use a little lubricant on the back of it. So I try to be as gentle as possible when I place it. And also at the end of the procedure, I try to be as gentle as I can when I remove that. Now, during the procedure itself, Dr. Piazza is excellent at doing injections for local anesthetic for the deeper tissues along the rib cage on the sides, and also the incision on the superficial areas in the front. And he does an excellent job with numbing up those areas. So typically there's no pain in recovery room, maybe a slight pressure for some, but he does an excellent job with covering with local anesthetic so that I don't have to get heavy-handed on opioids or some of these what they call strong painkillers, although there's all kinds of painkillers, but opioids in particular are notorious for causing nausea in some patients, which is why sometimes a medication like Zofran or ondansetron is a generic name, or Phenergan, also known as promethazine, may be prescribed by Dr. Piazza's staff or by Dr. Piazza so that you can have that after surgery in case for some reason you're having to use an opioid. You could take that just a little bit before, maybe 20 or 30 minutes before you take the opioid, and then take food with the opioid, and hopefully your tummy will be better off with all of that on board. So when he's done with this procedure, I'll just turn off the medicine that you're breathing through that device that I had placed. You'll breathe that anesthesia gas off, which is actually called a volatile anesthetic, but lay people call it gas. So once you breathe off the gas, you'll just be breathing oxygen. We'll get you to recovery room. Most people wake up within 10 to 30 minutes after I stop the anesthesia. It just depends on the individual. And I'll already have those anti-nausea medicines on board. Get you to recovery room. Like I said, you'll usually be in recovery about an hour. That's including that little wake up time. So 10 to 30 minutes to wake up, and the rest of the time for the remaining of that hour, just making sure that you're doing well and make sure you don't need any medication for any reason. And your family or friends will, whoever's going to be contacted, they'll typically, out of courtesy after we get started, we try to let them know that we're underway. Of course, you are our priority, but we will get to the phone as soon as we can to let your loved ones know that we're underway. And then of course, Dr. Piazza will be calling typically next to let your family or friends know how you did and how things went. And then of course, the recovery nurse in the recovery room will call 15 or 30 minutes ahead of time unless some other time frame is arranged, and let you know that you'll be ready for discharge soon. And of course, we try to do the bedside discharge instructions for whoever's taking you home so that it's very clear on what needs to happen next. So if you have any questions from any of this play-by-play for the day of your breast augmentation or other type of breast surgery, feel free to let me know during our consultation, and I look forward to taking care of you.